Good afternoon. My name is Kellie Metzdorf, and I work for the Elevance company for Anthem National Accounts specifically. I lead our advocacy, sales, and clinical account management team for the Northeast and Southeast. It's great to be with you guys today, but I gotta tell you, I have to make a confession before we get started. When my boss said to me, there's this opportunity for a TED Talk, and I think it'd be great for you to do it, I immediately said, I'd love to. But then he finished the sentence, and I heard the words artificial intelligence. I said, whoa, wait a minute. Me? You see, I'm probably the least likely person from a credibility perspective to speak to any technology whatsoever. But then he finished and said, it's really about the consumer experience. Now that I'm qualified to talk about. I am a healthcare consumer. It's a topic I'm pretty passionate about. So you guys get me today. At Elevance, we look at artificial intelligence really through the eyes of three stakeholders. First and foremost, and it may be some of you in the room, are Anthem members. How does it impact them? Second stakeholder that we look at are our providers that we partner with. And third, maybe most importantly, internally for our associates, how is AI helping them to support our members? So I'll touch on some things that are in varying stages of deployment, pilot, exploration, et cetera, that will touch all of those stakeholders. The experience, though, always anchors back because it impacts that end user, the member. You know, I think some people, healthcare doesn't get real until it hits them in the face. They get that really serious diagnosis. Maybe it's the child, maybe it's yourself, and in that moment, even if you have been in the industry for over 3 decades, you forget everything you ever knew about healthcare. Now you're in this world of uncertainty and fear. It's scary. At times like that, that is when you want someone to come in and help you. You know, some of you guys will probably agree, if you've been in the industry for any time, that we have been describing healthcare the very same way, very same adjectives, for at least 2 decades. I bet you could say it with me. I've heard the words multiple times today from other speakers. Healthcare, fragmented, right? Confusing, disconnected, all of those things. That is why I think artificial intelligence is probably the most exciting thing and most important thing for us to be talking about in healthcare today. Because maybe, just maybe, it has the opportunity to start to move the needle to simplify. That is certainly what we're hoping for. But before I jump into the examples of things that we're doing, I have to ask a question. So when did we turn into an immediate gratification society? And I'm going to be vulnerable here. I'm going to ask you a question. I just want to know, has Amazon same-day delivery ruined any of you? I mean, I can forget an ingredient for dinner, and I can have a drone bring it to me within minutes. And honestly, if I want to know what the weather is, I'm not going to watch the news. Or if I want to know what the score is to my Dallas Cowboys game, I'm just going to ask Alexa or Siri. Immediate gratification. Well, the thing is now that is what healthcare consumers expect too. So when we think about the deployment of AI, one of those things needs to be, how can we give them what they're expecting? That immediate gratification. Now, at Elevance, we've made a significant investment in technology, AI, digital capabilities, and you've seen the words on the screen from others. It's all about doing so in a very disciplined, measured, responsible way, tightly governed, and always with a human in the loop. That's sort of like the thing we all have to say. Our companies aren't going to be turned over to computers to run them, or bots. But the investments we've made, let's just talk a bit about the member experience, okay? From a member experience perspective, that immediate gratification I talked about, they want the answer immediately. One of the things that we've done with our investments is we recently introduced a virtual assistant within the Sydney Health app. We've released it to about 10 million of our members, and it's immediate gratification. It's for the most commonly asked questions that we get. Is this covered? Who do I see? What's it going to cost? So for those quick hit things, maybe they feel like they're talking to Siri or Alexa. They don't want to type and ask for the answer. Maybe they just want to ask. We've got that covered. That was introduced. Now, a more complex form of AI that we are exploring, and this is where, guys, I'm getting into territory because I'm not a technologist. There are some really smart AI people here today. I'm not that person. I'm going to say that again. But agentic AI is so exciting because agentic AI starts to pull together information from disparate systems and sources. So think about being able to have a snapshot when someone calls of their prior interactions, their claims, what other vendors they have in their ecosystem, all of it. Pulling that together to drive a very, very personalized experience. That's what agentic AI will introduce. So when we use those words fragmented and disconnected, that's where this could really start to come together. That excites me a lot. The other thing from a member perspective that we are piloting, and we're actually doing it here in New York, is a navigation and scheduling pilot. So if someone is looking for a provider online, they select one. What we really want them to be able to do is to quickly move to action. So if they find that provider, now it moves to book the appointment now. So that's a pilot that we're looking at in combination with EMR, electronic medical records, and our proprietary Health OS system. And really, that's just bi-directional data that we're sharing. The thought of it is if we are able to share data back and forth, we can take some resistance, some friction out of the system. Think about prior authorizations. Another pilot we have going is with a Virginia health system, and it's ambient workflow integration. Have any of you had your PCP say, hey, do you mind if I use AI? They're taking notes for me. Mine did. I thought it was kind of interesting. Well, that data all flows into this record that then, if they're part of that EMR, they can share with us and back and forth. And really what that means is faster intervention. It's getting people into case management sooner if needed. It's just we are talking. We are providing information back and forth with our doctors. And I think those are the little things that's going to start to move the needle again on complexity. Another thing that we're doing is really more focused on our associates, last but not least. I have to tell you guys, my very first job in this industry was the perky girl on the phone. I was customer service, frontline. I loved that job, but it was hard. It is the most thankless, toughest job. I'm sure any of you that have been in that, yep, I see a lot of this. It's hard. And you think about they're talking to a member, trying to listen, really listen to what they're saying, trying to interpret. At the same time, they're looking in different systems to find information, look up their benefits, look up this referral, see past claims. And oh, by the way, they're also supposed to be taking notes of that call, all at the same time. It's like the definition of insanity. So, we today have active. Artificial intelligence is sweeping behind the scenes. It is pulling together information. It is popping it to the desktop, voice triggers. And it's taking notes. It's doing all of that post-call documentation. That's a big deal. And then last but not least, I will share, AI could be a game changer for quality when it comes to member interactions. So we have 12,000 call agents at Elevance across multiple lines of business. Previously, our call audits were done manually. Well, you can imagine with 12,000 employees, that's kind of tough to do. We did between 2 and 5% we were able to audit. Today, 98% of member interactions, chat and voice, are audited. That's a game changer. CQI, immediate detection of operational issues, service issues, coaching opportunities. That I'm excited about. So here's the end of the story. AI is not just cool because it's the sparkly new thing and it's the technology everybody's talking about. Because the heart of what we do will always be run by humans. Yes, it's going to drive efficiency. Yes, it's going to take administrative burden away from providers, away from our associates. All of those things come together to make a better member experience. But AI will never deny coverage. AI will never conduct a peer-to-peer physician discussion. That's a human. Now our humans will be able to really focus, return that focus directly to that member when they're interacting with them. So, hopefully, we can start to tackle those, all of the fractures that we have, the disconnects, connect some dots, and maybe make healthcare feel a little more human. Thank you, guys.